So we have two formats today because we have 3 pairs of live contestants and everyone else who is logged in on Zoom. So the way we're gonna do this is to start off Jeopardy, I'm gonna put in a random number generator and come up with the first question that we will go through. For the live contestants, to be able to buzz in first, what you're gonna do is simply raise your hand on the Zoom chat. For our online members, the Zoom chat function has been disabled, so you will not be able to write in, just to make sure that no one is releasing any answers to anyone else. So please wait to buzz in after I've finished reading the question. If you buzz in early, you will be skipped and it'll go to the second team whose hand's raised on the Zoom function. So that's for our live people. Our online folks, when a question is selected, you'll have approximately 10 seconds to answer that question. It's going to pop up on your screen as a poll, and so you'll type in the answer to your question. Once the poll is deactivated, this is when I'm going to call on to the live contestants to go ahead and answer the question, so that way the online people don't get the actual answer from our live component. So again, online people, fill out poll, we'll deactivate the poll, call on the live contestant, and then we'll call on you guys in order of hand raise. For all the questions, we're gonna have 5 categories and I'll go through each one. The first team that answers, if you get the question right, you will get the point value assigned to that question. Although if you get it wrong, we're gonna play the advanced version and the point value will actually be subtracted from your overall goal. So make sure that when you're buzzing in on the question that you feel that you know the answer, because we will go into negative numbers. If you get the question correct, you will be the team that gets to select the next answer, okay? After that, we'll continue going through question by question on whoever got it last. And if nobody gets the question, again, I'll go back to the random number generator and I will select the next question. Throughout the board, there are 8 follow-up questions. And so these 8 follow-up questions, like I said, are randomly throughout the board. What will happen with these is if you select a question, you get the answer right, we will know that there's a follow-up question when we're on the answer screen. You'll see the answer and then it'll say follow-up. That question is automatically tasked to the team that got the answer correct. So it's pretty much like a double Jeopardy. And if you get that right, you'll get the points. If you do not get it right, it will be released to the other teams to answer, and there will be no subtraction of points for any guesses on that answer, okay? Let's see, what else? There will be a final Jeopardy in which the 3 teams will wager a certain amount of points and then go ahead and write down the answers in the chat. And that's how then we'll figure out the whole total and find ourselves a winner today. Please answer all questions in a question format. So all of your answers need to be what is or who is. I apologize, it's a little unconventional as far as my questions are not all phrased in statements, but your answers need to be in a question format. And if you're not, it'll skip over to the next person. Okay, let's move into our categories. First one, how could we do a pharmacotherapy EM challenge without some ACLS? So that's our first one. Our second category is going to be antidotes. Our third category, pediatrics. Fourth category, everyone's favorite, antibiotics. Want to give a shout out because it's the CDC's Antibiotic Awareness Week. So there are some antibiotic questions trickled into all of the other questions. So it's a little stewardship heavy today. Be prepared. And then our final last category is landmark trials. Now I'm gonna switch over my screen view and bring our Jeopardy board up. We will start off with each of our teams, just giving a brief introduction. Again, please say your team name, your names, and then where you are from. All right, let's go ahead and start with Adrenaline Rush first.
Hi, my name's Aram. I'm a PGY2 in Emergency Medicine Pharmacy at Rush.
And my name's Marissa. I'm a PGY2 Critical Care Pharmacy resident at Rush.
And we're very excited to be here. Thank you.
Thank you, guys. All right, next we have the Maripenna Maniacs.
Hi, I'm Dana. I'm a PGY3 in Emergency Medicine at Riverside in Newport News, Virginia.
And I'm Anthony. I'm core faculty at that same emergency medicine residency down in Newport News.
Awesome. Happy to have you guys. And then next up, the Herman Homies.
Hi, everyone. My name is Kayla. I'm a PGY2 critical care pharmacy resident at Memorial Hermann TMC.
And then I'm Kyle. I'm also a PGY2 at Memorial Hermann TMC in emergency medicine.
Awesome. Thanks everyone for joining us. Now that we're looking at the board, I do just want to call out. So 5 categories, 100 to 500 are our point values. You'll see this random 600 here on the bottom. That's going to be reserved for our final Jeopardy at the end. So don't pick 600 pediatric because it's not what it says. Okay, so to pick our category, I'm going to do 100 to 500 to get our point value. 129, so that's closest to 100. So we'll start off with an easier question. And then now let's get our category. All right, category 4. So let's go ahead and get this thing started. So category 4, bugs and drugs. Question 1. What pathogen of concern is most likely to be transmitted specifically by a dog bite? Online folks, raise your hand or fill out the poll. I'm going to give you like 5 more seconds, and then I'm going to go ahead and pick the team that has their hand raised. All right, Anthony and Dana, what is the answer to this question?
It's Canomorsis.
No. Who's next? All right, Herman homies,
What is Pasteurella?
can you be more specific?
What is Pasteurella multicida?
Savannah, what do you think is my backup? Do we take that or go to the next one?
I would accept.
We'll go ahead and accept this. The answer is actually going to be Pasteurella canis is more specific. Trying to be a tricky question that we said dog specifically. Both pathogens are going to be found in a dog or a cat, but specifically to a dog, Pasteurella canis. All right, now as a follow-up question that'll get turfed to Kayla again, our Herman homies, what is the preferred regimen and duration of treatment?
Augmentin 875 twice a day for 7 days.
So close. All right, who's next?
Augmentin 875 BID for 10 days.
Almost. All right, adrenaline rush.
What is Augmentin 875 BID for 14 days?
Ooh, everyone really just wants a long duration of therapy. 3 to 5 days will be an appropriate treatment for these patients. No one's going to get the points on that one. Okay, because no one got the points on that one, I will go ahead and use our number generator again. 1 to 5. So we have category 1. I don't know why I'm doing 100 to 500. Could still do 1 to 5, but anyway, that'll round up to 400. So we're in now category 1, 400 points, ACLS. Your team obtains ROSC after a VFib cardiac arrest. First set of vitals are blood pressure 141/82, a heart rate of 112. Amiodarone was called for during the resuscitation efforts and was administered post-ROSC at a dose of 300 milligrams IV push. Your repeat vitals after amiodarone administration are a blood pressure of 82/43 and a heart rate of 52. What is the likely mechanism of profound hypotension after amiodarone IV push administration? All right, no takers on that one. All right, the correct answer is what are co-solvents? Polysorbate 80 and benzyl alcohol have been associated with the profound hypotension seen in the amiodarone products. Next question then, we'll do the generator. All right, so we're back to 400 points. So that brings us to antidotes, 400. Mom calls 911 after finding son on the floor, altered and next to his empty pill box. Past medical history is notable for seizure disorder. Further workup in the ED reveals labs notable for an ALT to AST of 612/244, platelets of 20, ammonia of 112. The pertinent home medications include levetiracetam, 1,000 milligrams BID, divalproex, ER, 500 milligrams BID. Which antidote and initial dose should be given to treat the most likely toxicity? All right, let's go adrenaline rush.
What is levocarnitine at 10 mg per kg?
Close, but no, not correct. All right, any other guesses? Kayla?
What is levocarnitine 100 mg per kg?
Yes, ma'am. All right, so we got 400 points going to the Herman homies. Okay, and now since you got the correct answer, we'll go ahead and have you select the next one.
We'll do antidotes for 100.
All right, antidotes for 100. A patient presents to the ED after ingesting 90 of 240 milligram diltiazem extended release capsules. They are hypotensive and bradycardic. The Poison Control Center recommends high-dose insulin euglycemic therapy. Stat labs were obtained on patient arrival, and they were notable for a glucose of 160 and a potassium of 4.8. But the remaining BMP, CBC, and UDS are within normal limits. What adjunct agent should start simultaneously with the insulin infusion to prevent adverse effects of insulin therapy? And then I think Tony had a hand raised first.
What is dextrose?
Yes.
We got a thing.
All right, good work, Maripena Maniacs. Let's get you the points there. And then go ahead and select our next question.
Let's do ACLS for 100.
ACLS for 100. A 78-year-old male was found down by bystanders and 911 was called. When EMS arrives, they hook him up to the AED and discover he is in pulseless VTAC. According to the ACLS cardiac arrest algorithm, the patient should receive either a shock or amiodarone first. I believe it was Herman Holmes, but Savannah, what'd you see?
That's also what I saw.
Okay, take it away.
What is shock?
All right, we got 100 points going to the Herman Holmes. Okay, now go ahead and pick the next question.
We'll do ACLS for 200.
ACLS for 200. Of the following cardiac arrest etiologies, overdose of phenytoin, aripiprazole, imipramine, and oxcarbazepine, sodium bicarbonate is least likely indicated in one of these overdoses compared to the others. All right, Herman Holmes?
Yeah. What is aripiprazole?
Yes, awesome. Let's go ahead and give you the points. Now you got a follow-up question. Why is sodium bicarbonate potentially indicated in the other overdoses compared to aripiprazole?
What is QTC prolongation?
Not quite. Adrenaline rush.
What is QRS prolongation?
Yes, so sodium bicarbonate will work in QRS prolongation. These medications are more commonly associated with QRS prolonging compared to aripiprazole. All right, let's go ahead and go on to the next one. Adrenaline rush, up to you guys.
Bugs and drugs for 200, please.
Okay. A 56-year-old male presents to the ER from home with generalized fatigue and AMS, our favorite thing. A sepsis alert is called as the patient's initial BP is 72/53, heart rate of 112, and a temperature of 39 degrees. Pertinent past medical history is notable for hypertension. The patient has not been hospitalized since 2020 and does not have any prior culture history in the chart. The nurse notes that the patient reports dysuria and flank pain. Which of the following is the most appropriate initial antimicrobial regimen for presumed urosepsis? I did not catch who got that one.
It was the Maripena Maniacs first.
All right, Maripena Maniacs.
What is ceftriaxone?
Awesome, good work. We love a steward on our hands. Okay, now to follow that up, thinking about a patient of the same age who presents with AMS but does not have systemic signs of infection, they have normal vitals, no fever, and they come in with a complaint of a headache. What on that patient's urinalysis would be diagnostic for a UTI?
What would be nitrites?
No. Next person, any other guesses? I'm also gonna make sure I give you your initial score there. So Maripena Maniacs got it. Whose hand was raised first?
Adrenaline rush.
All right, adrenaline rush.
What is without squames having a presence of white blood cell counts, nitrates, and leukosterases?
Not quite. One more guess from the Herman homies. You don't lose any points, so you might as well just take a stab.
We were just going to say white blood cells greater than 10.
Okay. So this was a trick question, just being in the week of CDC Antibiotic Awareness Week. What's significant about this question is it just says the patient has AMS and they complain of a headache. So this is otherwise known as asymptomatic bacteriuria. And there's many other reasons why this patient might have AMS and a headache, such as dehydration, changes in diet, and therefore, despite what's on his UA, should not be treated just on that information alone. So I know we all love a good trick. Keep that in mind next time we have that AMS patient in the ED. Okay, I'll go back to my generator because we fell off on that one. We have category 1 and point value 200. That one's gone, so I'll just go to the next one. Okay, ACLS 300. Patient presents to the ED with severe shortness of breath and describes a recent gout episode in which he had extreme difficulty walking, rendering him immobile for 2 months. Since initial exam, the patient went into cardiac arrest and was now found to be in PEA. A bedside ultrasound shows right heart strain, and the team decides to proceed with administration of off-label tenecteplase. What dose of tenecteplase would you recommend initially for this 90-kilogram patient? And take it away, adrenaline rush.
What is 50 milligrams 50?
Yes, good work. So although if we look at our AHA versus European cardiac arrest guidelines, there's no preference as far as which thrombolytic. It says consult your experts. And if we choose to use tenecteplase, we should be doing a weight-based dose that's extrapolated from the STEMI dosing. So anyone over 90 kilos would get tenecteplase 50 milligrams in this situation. Okay, let's go back to the board. Adrenaline rush, what question would you like next?
Drugs and drugs for 300.
A 23-year-old male presents the emergency department after an electric scooter accident. During the trauma primary survey, the patient's found to have a 15-centimeter open fracture on the left lower extremity with extensive tissue injury. The patient denies any allergies, and the patient does not have any comorbidities. What is the most narrow and appropriate single-agent antibiotic regimen for this patient that allows for timely administration in the trauma bay?
It looks like Herman Homies was first.
Take it away.
What is cefazolin 2 grams?
Not quite. Next team, who is that? So they will get reduction on that. Okay, I'm gonna do this random number generator again, and we're gonna do 1 versus 2. Okay, oh, I didn't even assign who's 1 and 2. That would have helped, huh? Okay. We have oh no, but you are 1 and 2, so it does work out. So if we have 2, that's meropenem maniacs. So what's your answer?
What is ceftriaxone?
Yes. So because it's considered a grade 3 fracture based on the extensive tissue injury as well as the length of the open fracture, cefazolin would not be the appropriate answer. You could use a first generation cephalosporin in combination with gentamicin. Otherwise, you would want to use ceftriaxone as a more broad agent to fully cover for all those gram negatives. And then meropenem maniacs. Which question?
Let's do ACLS for 500.
Okay. I really see everyone loves pediatrics. And it's funny because that was the category that took us the longest to develop because we all kind of felt the same way. It's something we were avoiding. What is the off-label endotracheal dose of lidocaine in mg per kg for initial management of ventricular fibrillation? And who is our answer?
Adrenaline rush.
All right, go ahead, adrenaline rush.
What is 2 mg per kg?
I will take it. Yes. So endotracheal dosing for medications such as the acronym NAVAL would be all the medications that you can give endotracheally, which lidocaine is the L in NAVAL. If you were going to give medications via the ET tube, you should do approximately 2 to 2.5 times the IV or IO dose. And for this, it would end up being 2 to 3.75 mg per kg of lidocaine because that is 2 to 2.5 times the IV dose. Perfect. And adrenaline rush, which one?
Can we do pediatric for 200?
Yes. IV magnesium sulfate may be used as an adjunct therapy during a severe asthma exacerbation in pediatric patients over the age of 5. Over what duration should the magnesium dose be administered? Okay, adrenaline rush.
What is 20 to 30 minutes?
Great. Some data shows that like anywhere from 15 to 30 minutes was what was most commonly studied. The most recent GINA guidelines, though, do recommend specifically 20 minutes in their guidelines. But I'll take 20 to 30 because 30 was also in a lot of studies. Back to the board. Adrenaline rush.
Can we do antidotes 200?
Antidotes 200. What empiric dose of fameprazole is considered an adjunctive therapy for massive acetaminophen overdose in patients developing acute liver failure? Adrenaline rush.
What is 10 mg per kg?
No. And next team, anyone else want to take a stab? Herman homies?
What is 15 mg per kg?
All right. Dose should be empirically, or the initial dose, 15 milligrams per kg IV once. And now the follow-up turfs to you guys. What is the mechanism of action for how fomepizole works for this indication?
Induction of the cytochrome P450 system. I don't remember which enzyme though.
I'm not going to take away points, but I'm not going to take that answer.
The specific enzyme being CYP2E1.
Yes. All right. We will give you that point there. Okay. Now, next question, we'll go to you guys. Which category do you pick?
Peds 100.
A 10-year-old male, 30 kilograms, was brought into the ED by EMS and PEA arrest. The patient is due for a dose of epinephrine immediately upon entering the resuscitation bay. What dose of epinephrine in milliliters, assuming standard epinephrine concentration of 0.1 mg per ml in a pre-filled syringe, should the patient receive?
Maniac was first.
What is 3 milliliters?
Yes. Is there a follow-up on this? No, no follow-up on this one. So let me go ahead and add your points. A nice, easy weight-based dose calculation, as most of our pediatrics require. And now go ahead and select the next question, Maniacs.
Let's try bugs and drugs for 4.
Bugs and drugs for 400. Which of the following options is not an appropriate treatment option for a patient presenting with a urine culture confirmed ESBL, Klebsiella pneumoniae, uncomplicated cystitis? Your options are nitrofurantoin, I'm just going to say Bactrim because I'm not going to let everyone hear my list, fosfomycin, and gentamicin. Okay. All right, no answer on that one, but the answer is going to be, what is fosfomycin? According to the most recent IDSA MDR guidelines that came out this past year, fosfomycin should only be prescribed for ESBL E. coli, especially as empiric treatment. So that is the correct answer for this one. I will go back to my generator to pick our next question. We have category 1, but I think that one's gone. Yeah, none there. So I'll move over to antidotes and 4, which for 3 or 5. So I'm just going to select 300. According to the expert consensus guidelines for stocking of antidotes in hospitals that provide emergency care, which of the following antidotes is not required to be stocked at treating hospitals? Is it dantrolene, flumazenil, octreotide, or methylene blue? Then I saw Maniacs were first. All right, Maniacs.
What is methylene blue?
No. Who's next?
Herman homies.
What is octreotide?
Yes. So I need to subtract points from Maniacs, give points to Herman homies. And lucky you, you get a follow-up question. Which medication is on this 2018 stocking list, but is no longer commercially available due to the closure of the U.S. drug company? And again, no points removed for guessing.
What is physostigmine?
Yes, good work. Acorn Pharmaceuticals closed. It was already on shortage. And then 2023, I believe they shut down. So no longer available. Now we will go back to the board. Which question do you guys want to do next, Herman homies?
We'll do antidotes 500.
Antidotes 500. All right. EMS brings a 67-year-old patient from home after he was found down by a neighbor in his driveway. Neighbor notes to EMS that they think he recalls the patient telling him he was diagnosed with TB after visiting Zimbabwe for a safari trip. In the ED, the patient is noted to be in status epilepticus, and upon resident's brief chart review, he notes that the patient is on right therapy. Patient received 10 milligrams of midazolam intramuscularly en route with no effect. What antidote, dose, and administration would you recommend next for this patient? Really making you work for that 500 if you want it. And I do recognize that this question's rather challenging, so I will now take away the subtraction of the points and give you points if you can get one of those answers. Maniacs.
What is vitamin B6? I believe the empiric dose is 5 grams. I do not know the administration rate.
That's okay, because I just said 2 of them. I made it simpler, and good work, Maniacs. That's a tough one. Okay, so vitamin B6 or pyridoxine, 5 grams administered at a rate of 0.5 to 1 gram per minute. So that would be 5 to 10 minutes. It's basically a slow IV push. It is not on here as a follow-up question. So don't raise your hands yet, but I will give follow-up points. What drug are we giving this antidote for? Savannah, who'd you see?
Meropenem.
What is isoniazid?
Yes, good work. Next question.
Pediatrics for 300.
Okay. Which medication is the most important to manage moderate agitation and prevent need for restraints in a pediatric patient not previously taking any medication, difficult IV access, and a new psychiatric diagnosis? Your options are IV lorazepam, IM olanzapine, IM droperidol, or IV ketamine. Herman, homies?
What is IM olanzapine?
Yes, it would be IM olanzapine. The point for this question is just noting that they have difficult IV access. Ketamine is not going to be an option for that. That's, for pain dosing there or severe agitation. Would likely want to avoid benzodiazepines in pediatrics if possible, and olanzapine preferred to droperidol based on generation of antipsychotic and less risk of EPS. Okay, next question from, I don't think I gave you the points for that. I apologize. I didn't, right? Herman, homies.
We'll do landmark trials for 100.
This trial, published in 2021, showed treatment with intravenous or intraosseous calcium did not significantly improve sustained return of spontaneous circulation among adults with out-of-hospital cardiac arrest. What is this trial? Go ahead, adrenaline rush.
What is the COCO trial?
Yes. All right. The COCA trial did show no significant difference between those two different populations. Did not significantly improve rates of ROS. Okay, go ahead and click your next one, adrenaline rush.
We'll do pediatric for 400.
A 4-year-old 15-kilogram patient presents to the emergency room with greater than 10 minutes of ongoing convulsive seizure activity. The patient has received maximum benzodiazepines, lorazepam 1.5 milligrams IV times 2 doses, and levetiracetam 900 milligrams without seizure cessation. The team decides the next line agent is phosphenitoin. You are preparing this medication at the bedside for administration. What is your final dose? Okay, take it away, meropenemaniacs.
What is 300 milligrams?
Yes, good work. Got a higher score now. You guys are in the lead. And next question.
Pediatrics for 500.
Which of the following may be considered a one kill in a 1-year-old pediatric patient? Is it metformin, ethanacol, diphenoxylate, or tacrolimus? All right, Herman, homies.
What is diphenoxylate?
Yes, good work. And lucky you got the follow-up question. What would you provide to this pediatric patient who's presenting in your ER with respiratory distress? All right, no answer. Other two teams, adrenaline rush?
What is atropine?
No, but no points lost. Meropenemaniacs?
I have a feeling this isn't the answer, but any respiratory distress patient, what is intubation?
You know what? I will give it to you because it's really supportive care in addition to potentially naloxone for respiratory distress. Of course, you're going to secure your airway, but you should be considering naloxone at the same time. Okay, meropenemaniacs?
Let's do bugs and drugs for 500.
Oh, you're going to love this question. KM presents as an ED to ED transfer in need of treatment for severe malaria after visiting family in Nigeria. Her labs from the OSH are notable for greater than 5% parasitemia. She has a creatinine of 4, BUN of 30, and hemoglobin of 5. She appears to be in respiratory distress, and the team is discussing intubation. What anti-malarial should be initiated as soon as possible? All right, Herman, homies?
What is artesunate?
Yes, good work, good work. Yes, artesunate given parenterally, whether it's IV or AM, should be given as soon as possible as the diagnosis of severe malaria is made. If you're a referring center, then you might consider starting an oral agent if you do not have IV artesunate, although this is more likely to be on many hospitals' formularies and more available. As severe malaria, they do need definitive treatment and should receive artesunate. So now you guys can pick the next one.
We'll do landmark for 200.
The ESET trial concluded 3 second-line agents used were all equally efficacious to treat benzodiazepine refractory status epilepticus. what 3 AED and their respective doses were studied. You have to have the full answer to have it right. Okay, Herman homies.
What is Keppra 60 milligrams per kilo? What is phosphonatoin 20 milligrams per kilo? And then what is valproic acid 40 milligrams per kilo?
Awesome. Good work. Yes. Now, follow-up question is approximately what % of patients in the ESET trial did not receive recommended initial doses of benzodiazepines, aka underdosed and probably not benzodiazepine refractory? And I will give you the answer correct within 10%. Maripenamaniacs.
What is 75%?
Yes. So 70% is actually looking at internal data, like from all the EDs, 70% were underdosed on their initial benzodiazepine dose. And if you look at pre-medical arrivals, so like EMS doses provided as well and incorporate those, that underdose percentage actually goes up to 80. So 70 to 80%. And then now it's going to go to Maripenamaniacs.
Let's do 300.
300. In the recently published Anexa I trial, what is the predominant indication for anticoagulation amongst the patients studied? Herman homies.
What is atrial fibrillation?
Yes, good work. And the reason why this is important is, we're extrapolating this data, thinking about all our patients presenting with a VTE that you're considering to reverse. It's important to note that most patients in this trial, again, presented with atrial fibrillation as their indication for anticoagulation, and therefore might not be as more prone to clotting as someone that already has a VTE receiving Anexa. According to AHA's 2022 guideline for the management of patients with spontaneous ICH, in patients with mild to moderate severity ICH who present with an SVP between 150 and 220, acute lowering of SVP to a target of 140 with the goal of maintaining in the range of 130 to 150 is safe and may be reasonable for improving functional outcomes. This recommendation was updated from the previous guideline based on data from which 2 trials? And you have to have both trials.
What is Interact 2 and Attack 2?
Good work. Getting that score up a bit more. And go ahead and take the last question. We'll default, because right, we did everything else on the board. Yep, it's clear. The Dynamo trial published in 2020 concluded otherwise healthy patients presenting to the emergency department with mild acute diverticulitis who achieved good symptom control in the ED may be discharged home with symptomatic management and close follow-up only and may not require antibiotic therapy. Name 3 patient populations excluded from this trial who you may not be able to extrapolate the results to, aka may warrant augmentin. I want to make sure I have the whole exclusion list up because I have most of them memorized, but definitely going to forget one of them. Go ahead and take it away, Adrenaline Rush.
What is immunocompromised patients, pediatric patients, and pregnancy?
Yes, those will all count. Let me just read off the other ones that were also excluded. All right, so pregnant or breastfeeding, less than 18 years old, greater than 80 years old, allergy to any of the study drugs, acute diverticulitis with a modified NEF classification of stage 1 or higher, history of inflammatory bowel disease, presence of significant comorbidities, which would be diabetes or CKD, immunosuppression or immunocompromise, poor symptom control at the ED, defined as a VAS greater than or equal to 5, presence of systemic inflammatory response syndrome, SIRS, or sepsis. So you guys get points there. And then now you also get a follow-up question. All right, I wrote them all here. Anyway, your follow-up question is going to be, in the trial, they utilized augmentin. What is potentially problematic about this intervention as the drug of choice for diverticulitis?
I think for side effects, having diarrhea is a part of it.
I'm going to say no, because the other treatment options likely would cause that too. Maripenamaniacs?
What is questionable gram-negative coverage?
Yes, I will take that. So basically in diverticulitis, E. coli, probably most likely bug of concern, although we also have anaerobes and other GNRs that can be present. Most hospitals have the personalized antibiogram that you should be checking before you decide whether you're going to prescribe augmentin. Here at my hospital, our resistance rates are 56%. So considering where you're practicing, augmentin is not going to be a good option for you. All right, points there. So then now I know that we're cutting it close. Do my 3 live teams have a moment to do final Jeopardy, or do we need to wrap up? All right, let's go ahead and move on to Final Jeopardy. So for this, I would like each of the teams, how much are you gonna wager? Go ahead and write in the group chat what you wanna wager for this question, and then we'll collect your responses in a moment. So Adrenaline Rush wagered 1,800 points. Maripena Maniacs wagered 300 points. And 3,000. And Herman Homies also wagered 3,000. Now, they're not gonna be able to write in the poll.
I think we can write.
Okay,
Should we put it in the,
yes, go
yes,
ahead.
okay, just wanna make sure.
That way we don't see everyone's answer. All right, answers in. CM, are you able to see on your side what those 3 answers were and read them off to us?
Yes. We did have 5 total that answered it. Kayla has answered Clostridium. It says Group A strep.
Which team was this?
Iram Nasreen from
Okay.
Rush. Okay,
Got it.
so Adrenaline Rush. All right, and then is it Anthony with the 3rd team? What is Clostridium perfringens?
Okay. I'm gonna give the correct answer to Anthony because it's the most specific. So if you didn't answer Clostridium perfringens, which I definitely butchered the name, you are gonna get that wrong. For Adrenaline Junkies, they had 1,800 and wagered 1,800. That brings you to 0. The Maripena Maniacs, you had 3,500 and wagered 3,000. That's gonna bring you to 6,500. And then Herman Homies, you had 3,100 and you wagered 3,000. That's going to bring you to 100. Our winner for today is Maripena Maniacs. 2nd place, Herman Homies, and 3rd place will be our Adrenaline Rush. I really think today went off well. There was some technical pieces that hopefully we can hash out for next year, but thank you to everyone who joined us today. I think this was a lot of fun. I hope you learned something new. And the education committee, as part of AMP, will send you out a follow-up as far as all the rationales to the answers that we selected with citations. So thanks again for everyone joining. I will review the online answers and come up with an online winner. They will receive a gift card, and our Maripena Maniacs will each receive a gift card as well. So we'll follow up with you over email. Thanks again to everyone who joined. It was great having everyone.
Thanks, everybody. That was a lot of
Yeah,
fun.
this was so much fun.
Thank you.
Bye.